Hi, I'm Dr. Dooley and welcome to my channel. I'm a board certified psychiatrist practicing in Georgia, and the mantra on this channel is that we meditate, mobilize, and manifest the things that we want in life. I will be continuing my series on psychiatry frequently asked questions today and addressing the question, Doctor, will I be psychiatrically hospitalized? Before I jump in, just a reminder, this information is for educational purposes only. It doesn't constitute individual medical or mental health advice. And as always, if you have questions about your mental health treatment, contact your therapist or your psychiatrist. Reasons why people may be hospitalized psychiatrically. So one of the more common reasons is that people may develop psychotic symptoms. So one example would be paranoid thoughts. So people may develop paranoia to the point that they believe people are out to hurt them or do harm to them in some way, even though there is nothing in reality that supports that. People can develop delusional beliefs. A delusion is a fixed false belief. That means that no matter what information, no matter what evidence you give a person, they believe that thought is true. So an example of a delusional belief would be a person believing that they are best friends with the president. And no matter what information you give them, including, let's say if you could give them information that they've never met the president, they will still believe that they're best friends. So it's fixed and it won't change. That's an example of a delusional belief. Another type of psychotic belief is hallucinations. So if you think about any of your five senses and having a sensation in any of your five senses that's not based in reality, you can have hallucinations where you see things that aren't there, hear things that aren't there, smell, taste, feel. You have those sensations, but there's nothing in reality to support that that's happening. We would call that a hallucination. So those are psychotic symptoms. Other symptoms that occur that can lead to a person being hospitalized is people having suicidal thoughts. That would be thoughts to end their life, or homicidal thoughts, thoughts to hurt other people or end the life of another person. Just having those thoughts alone typically doesn't lead to being hospitalized. Even if you have those thoughts and somewhat of a plan, that doesn't necessarily mean that you'll be hospitalized. But if people have thoughts to hurt themselves or other people that is well developed, and they've taken steps to act out on it, and considering some other factors like their past history of hurting themselves or someone else, for example, having those thoughts with those extra plans could lead to a person being hospitalized if they have suicidal thoughts or thoughts to hurt other people. So it doesn't automatically mean you'll be hospitalized, but depending on your personal history and what other risk factors you have in the moment, you could be hospitalized for having suicidal thoughts or homicidal thoughts with a plan and what we call intent, meaning you're taking active steps to act out on it. And thirdly, people can be hospitalized if they show symptoms of mania. So we're going to talk on the channel later more detail about what mania is and in the context in which it occurs. But essentially, mania is it's part of the mood disorder that's called bipolar disorder. And when people become manic, they have a change in their mood. So the change in their mood can be very happy and elevated, or it can be very irritable. And along with the mood change comes a change in behavior. So people may start to feel very full of themselves and think that they're very important or have a very important mission or important information to give. They may talk very fast to the point that it's hard to understand them. Their thoughts can move so fast, it's hard for an external person to follow them in conversation. And people may start to have other behaviors that are out of character for them. Like they may start spending money excessively. They may be very hypersexual. So maybe, for example, having sex with people at work. And even when people are manic at times, they can develop psychotic symptoms too. So all of that put together could be a reason why a person could be admitted to a psychiatric hospital. So just having bipolar disorder or just having suicidal thoughts or even just having thoughts to hurt other people, those things don't automatically mean you'll be psychiatrically hospitalized. And I think that's important to know because sometimes people do struggle with having symptoms and they're worried that if they tell someone, particularly a mental health provider, it'll automatically mean that they get hospitalized. And it's just not the case. So while there are certain circumstances that can lead to a psychiatric hospitalization, just having a diagnosis or just having a symptom all by itself doesn't automatically mean that you'll be psychiatrically hospitalized. It matters what's going on when you're having the symptoms, what is your past history with the symptoms, and what is your ability to actually manage what is happening. Well, I hope you enjoyed this short video that talked about circumstances that can lead to psychiatric hospitalization. If you find the information helpful, please like the video and subscribe to the channel. And we will talk about psychiatry again soon.